Some incidents and disasters pose a direct threat to the public. And in response, emergency officials may order an evacuation. When that happens, first responders play a vital role in assisting people with access and functional needs.
You're going to find people with access and functional needs in your hood and my hood. We are everywhere. We're part of the community, and we are totally integrated.
My name is David, and this is my service dog Hawk, and I'm a wheelchair user.
My name is Luke, and I use a communication device.
Hi, my name is Paul, and I use a cane.
It's really people who have mobility impairments who depend on public transportation to get around, depend on paratransit to get around, and those who may not have cars may have some level of need for assistance, but they're not necessarily going to need it to be entirely accessible. They may have durable medical equipment like a wheelchair, like a shower chair, a Hoyer lift that they're going to need to be able to maintain themselves in the general population shelter. And for first responders, it's really critical that you work with those individuals to take their equipment. A functional need most of the time is not a medical need whatsoever. It's about a person's ability to be, for mobility, to be able to communicate. The majority of people with disabilities live independently in the community, and that's so critical for everyone to remember in a disaster that shouldn't change.
You may need to assist people who don't speak English, older people, children, people with thinking, remembering, or understanding limitations, people with mental illness, people with specific dietary needs, and pregnant women.
Our society is diverse. In some cases, communication could be a challenge, but there are some simple things you can do.
Well, the object isn't to have a lengthy conversation or a complicated conversation. You can use pictograms or drawings, but the bottom line is that you can communicate the need to quickly and safely evacuate.
Well, it's important to realize that some people have hidden limitations. Somebody with autism may act like they understand what you're telling them, but they may only be repeating what you've just told them. And it's important to know the difference.
Well, you got to try to do your best to quickly recognize that there's a disability here, having a hard time communicating with them. And then once you realize that, be patient, give them some time. That way you can effectively communicate and get the message along and move along quickly to the next.
First responders should ask. We know our disabilities and what limitations we have and how to best address them, and in the quickest, most efficient way. Talk to your local independent center and include them in your training and your drills, and practice for these needs before you're actually in the emergency.
To learn more about working with people with access and functional needs, personal preparedness, or evacuation planning, go to www.calema.ca.gov.